widely acknowledged COVID-19 vaccine inequalities persist in the midst of course, the discovery of these new variants. While over 100 countries support the TRIPS inoculation waiver proposal, powerful states including Canada, Germany, Japan, Norway, Switzerland and the UK, as well as the European Union, still have not fully supported the proposal. For more on this, we're joined by Wits University Law School Associate Professor Jackie Dugard and international trade law expert Franziska Sucker. Good evening to both of you, and thank you so much for your time. Professor Dugard, perhaps let me begin with you. Is it surprising really that when we look at how these countries have responded to the TRIPS waiver and how they continue to respond to the discovery of whether it is the variant today or any other developments around COVID-19 by shutting down their borders? Should we really be surprised, or are they following what has been the trend, and does it speak to fundamentally the position they hold about how, COVID-19 should be responded to and how they want to protect their own nations and not looking at it as a global issue?
Sorry, good evening. I think you're absolutely right about that. It's not really a surprise. It's, of course, very disappointing. And as I think many people are commenting in the past few days, it's very disheartening that when a country like South Africa does the right thing and publicizes a sequencing of a new variant, which we don't actually even know yet where it originated. But we came clean and said what we found as soon as we found it, that we would be so rapidly and seemingly unfairly, adversely affected like this. But as you say, it's not really a big surprise, as it is already, we are in the global south, suffering the consequences of an unequal world in which, of course, the global north is trying to satisfy the interests of pharmaceutical companies and profits, and seemingly putting these above the lives of people in the global south. So it's very disappointing, and Franziska and I are part of a collaboration, an international collaboration that is attempting, along with many other people, to try to rectify this by pressurizing the states that still hold out and do not support the TRIPS waiver for them to support the TRIPS waiver so that there can be more cheaper, more swift access to vaccines around the world. Because as we understand now very well, until we are all safe, no one is safe. And that's something that unfortunately the global north seems not to have quite grasped yet.
Franziska, on the one end, we're seeing the scapegoating that is taking place. But on the other, of course, it's a case of deprivation when it comes to access to vaccines. These responses, the more one begins to look at them, more and more do not make sense.
So, if I understand you, that you asking again about the responses, that they don't make sense. And when you think about the IP response, are you asking about the response from the global north or for the TRIPS waiver? Because the TRIPS waiver would make sense.
So I'm asking about the response from the global north.
The response from the global north in this instance makes no sense, as Jackie already alerted to, because it was not even originated here, and you cannot prevent it. But the response with regards to not supporting the waiver makes no sense. That is not per se the global north, that are specific countries, because there are countries in the global north that do actually support the TRIPS waiver, but it is specific countries, and mainly that host actually those pharmaceutical companies. One major example is Germany. And they not support exactly a response that is not the absolute solution for having equitable access and full access, but is one step that is absolutely necessary to remove the legal barriers that are at the moment existent for countries to at least have a chance to scale up and to maybe produce more generics and have more access to generics in countries where they can be produced cheaper.
A couple of months ago, we seem to have been gaining a lot more momentum when it came to the support for the TRIPS waiver. What has happened that seems to have quietened things down, Franziska?
What has happened is, when you look at the effect of the proposal, is that companies have entered into voluntary cooperation agreements. This is a good thing. But it's certainly not enough. And these voluntary agreements were entered into mostly in order to show that there's no need for a waiver. And the second the waiver will be rejected, that is not necessary anymore to enter in those voluntary cooperation agreements. It might also be that we don't even know what is exactly in those agreements. There are many exclusivity agreements that some parts of the world are completely excluded because the companies choose where they would like to cooperate with. There are other issues of indemnity clauses that try to be put in those agreements. We have no access to those agreements, so that can't be the only solution. It's a good step that the waiver proposal has achieved that, but the second the waiver proposal will be rejected, that pressure is ceased.
Professor Dugard, are we seeing any changes when it comes to the issue of costs and the cost at which vaccines are being made available to countries on the continent?
I think that's a difficult question to answer. I'm probably not best placed to answer it, not least because a lot of these agreements are not in the public. For example, I'm not sure that we have access to what we are paying in South Africa for the Pfizer or the J&J vaccines. And this is sort of part of the problem, that governments are being forced into secret deals. We don't know how much we're paying to a large extent. Now, I think that, one thing one hopes is that if the TRIPS waiver is supported and if a consensus agreement is reached, that then you would have the ability to bring the cost right down. And then you could, if you had manufacturing capacity and your country supported it and was able to change the legislation, you could reverse engineer. There's quite a lot of, I believe that in South Africa we have the capacity probably quite quickly to be able to make mRNA vaccines. So this is really what we are pushing for, because at the moment, drug companies have got a lot of the world's countries, over a barrel. They can charge what they like, really, because it's a desperate situation and countries will pay what they can and sometimes maybe what they can't in order to get vaccines. So I'm not sure if Franziska knows more about the pricing issue, but I think part of the problem is, in fact, that we really don't know how much is being charged for a lot of these drugs.
Franziska, you can go for it if you've got something to add on that issue.
What is known is that South Africa had to pay significantly more than, for example, the European Union. It was said twice to three times, in Uganda, for example, even more. What is known is that in Botswana, they charged so much and then did not even receive the ordered products. And what is also known is if we increase generic productions, those prices will drop. That in the past that has happened with other drugs where compulsory licenses were used and generics produced. Usually the price discrimination is then largely, it's not gone, but it is, at least there is a way against it. That means a country, and I picked that randomly now, like Malawi, who has really no production capacity or very limited, would be able to source from a country that can offer it more cheaper than the initial manufacturer would do. And that is the aim, to have a more offers, so that that automatically leads to more competition. That is a normal economic consequence, and more competition leads to dropping the prices, because we all do know that pharma companies do charge more than they would usually need to, and maybe that is a bit different here in this pandemic because they're more open and transparent about it. But because they are more open and transparent, we also see that there is this discrimination. And that is due to pre-purchase agreements. So the reason why the EU did pay so little was because of pre-purchase agreements. And that is a problem. So, and that is only when actually the company is willing to export. And for Africa, that's a problem, because it's a dependency to the willingness of a specific company and a specific state who wishes to assist. And in order to change that, we have to build regional manufacturing capacity. And that is not possible without the waiver, because the waiver blocks this, because at the moment we cannot issue compulsory licenses that work cross-border.
Franziska Sucker and Jackie Dugard, let me thank you both for your time tonight on that issue.